All right. So let me just introduce everybody, and then we will give a couple microphones to them, and we'll be walking around the room so that you guys can ask questions. And I know them all really well, but I don't know actually their bios, so I do have to read this. I apologize. All right. So J. Lee Maldonado. Okay. She received her master's degree from VCU, and she has used to work for the ALS Association, and we were successful enough in convincing her to come over and work full-time for VCU in our neuromuscular and ALS clinic. So she is our social worker, and she'll be able to, in a minute or two, talk about what she does and then the role of social work in helping you with all of your questions. Paula Brockenbrough, she is a respiratory therapist, and she's been a respiratory therapist for well over 30 years in both the acute care setting and in the outpatient setting. She has been with us in the neuromuscular clinic for over 10 years now and has co-authored multiple papers and abstracts in regards to respiratory care in patients with neuromuscular disease. Ashley Moneymaker is our occupational therapist. She graduated from James Madison University and used to do a lot of acute care neurorehabilitation, and over the last few years has transitioned to the outpatient setting and is in our neuromuscular clinic on a regular basis. And then we have, last but definitely not least, the most important person of all care teams is the nurse coordinator. And so Michelle Gebhardt is the nurse coordinator for our muscular dystrophy and ALS clinics. She has been at VCU for just over 20 years now and has a wealth of knowledge in regards to coordinating the care and understanding the important role of nursing in the care of our patients. So I'm going to let them talk just 2 to 3 minutes each about what they do, and then we just want it to be for you guys. So there's 45 minutes or so for you guys just to ask questions. I can always ask them questions, but we want you guys to start. So Jay Lee, why don't you start and tell us about social work?
Sure, my team already decided that for me. So my name is Jay Lee. I actually just came from my daughter's preschool graduation, so excuse any makeup that's running down my face. So today actually makes 10 years that I earned my master's from VCU, School of Social Work. And so the one-liner, right, the umbrella answer about what I do is I assist with adjustment to illness, right? So patients and families, as well as adjustment to progression. And what does that mean? So, because that's just a one-liner. It means a lot of things. Some of the things that I do are very case management based. Access to medications, questions, how can I afford this? Are there any grants out there? Community-based resources, same for DME or durable medical equipment needs. Additionally, just being a support. So my background is in counseling in the community, specifically dealing with depression, anxiety, trauma, and substance abuse. And so really, unfortunately, I can't in this role as much follow and provide long-term counseling, but what I can do and what I appreciate doing in the clinic setting all the time is being able to kind of provide brief intervention counseling. So what that means, if you're having a hard time, I tell people I'm in no position to judge anyone, and I'm definitely a safe space. So if you need to process anything, feelings, and this goes as well for the families as well, that's something that a service that I provide. And typically, I will, if I meet you for the first time, ask some questions. I promise it's not because I just want to be nosy. It's really to get a good assessment of what you have access to. What kind of support do you have, whether it's community-based, church, family, friends, anything, so that I know when we're working together down the line, if there's ever a concern, a need in any regard, I know how to initiate resources and what kind of things that you would need in particular. Also, I get a lot of questions about disability applications, insurance. So by no means am I an expert on any of those topics, but really my goal and my job is to make sure that I try to stay abreast of all upcoming updates and things of that nature in those areas, but most importantly, knowing who to send you to. If I don't have the right answer, oftentimes there's some additional support in the community that you can get some more specific answers from, and I can kind of serve as that liaison, if you will. So I'm happy to take your questions once my colleagues get to introduce themselves, but I'm happy to be here. I'm very passionate about the work that I do. Medical social work is still fairly new to me, but I like to think that all of the professional experience that I've had just being in the community, those skills have definitely been transferable. And like I said, I'll never make anything up. I promise to be transparent, and if I don't have the answer, I'll find someone who does. Thank you for having me.
Ashley,
So I am Ashley. I've been at VCU for 14 years and recently transitioned to outpatient as well, helping cover with the clinics. The role of OT really is to keep you functional, right? Looking at what you can do, looking at what you like to do, and making sure that you can still engage in those activities. So finding either adaptive strategies, use of adaptive equipment, whatever it may be to function with what you need to do, with what you want to do, and how you want to occupy your time and fill your time. So we work closely with physical therapy too, stressing exercise, right? Keeping you healthy so that you can engage with family, friends, work, whatever you're doing to fill your time. So much short-winded than Jaylee, but.
I'm Paula Brokenborough. I'm one of the respiratory therapists. There are two of us who come to clinic. I'm the one you'll usually see. Dr. Voda asked me to join his clinic about 10 years ago. Multidisciplinary clinics have such a profound impact on your care and how well you do with your disease process. So when you see me, I'm old school. I write with a pen and a piece of paper, and I want to look at you when I'm talking to you. I ask about your previous medical history. I'll ask if you smoke. Do you get vaccinated? Do you get short of breath when you're getting dressed? Do you notice that at the end of the day, you might have some trouble speaking? Maybe you need to take more breaths to be able to say something that normally you could say 5 sentences in a row, but by the end of the day, you're winded and you're like, okay, I'm really tired. I've done 6 things and now I'm exhausted. We ask all those questions depending on what the physician is looking for. Your neurologist, I might do some breathing muscle mechanics on you just to see what they are. We have standards if you're, for your age, your height, and the gender you were born with, what is normal if you didn't have a chronic disease. So the neurologist, myself, talk about what those numbers look like. We have a terrific pulmonary team at VCU MCV, and I'm kind of the pushy one of the bunch, maybe a little bit. So I'll call up pulmonary and I'll say, hey, I have this patient. You've seen them in your clinic. I want to get them back into your clinic because I've noticed some different things. I also work with Rebecca, our dietitian, because your weight affects how your breathing is. We work with PT and OT because your mobility also affects your breathing, so we want to keep all of that together. I work with Jaylee because if I notice something going on with you, she's my resource for your psychosocial stuff. But really, the most important member of the team is the big honcho here, which is Michelle.
My name again is Michelle Gebhardt, and I've been with the Department of Neurology for greater than 20 years. And my job is to coordinate our multidisciplinary team. And so I probably have the best job out there with the team that we have. So I coordinate the doctors to make sure that when you're here for your visit that you get to see all the disciplines that you need to see while you're there. So PT and OT, that's very valuable for limb-girdle patients. Definitely the respiratory, the social worker. Jaylee and I work hand in hand on many cases to try to get things settled for you. Try to work on patient assistance for medications that are needed. And then a lot of my work is done after clinic is over. So I have to look at the list, go through everything that happened for the day, make sure prescriptions got to the right place, that your equipment is been sent off and you will be getting it. I triage all the phone calls after clinic. You're always welcome to call me. I have a direct line to call. I think that probably sums up all that I do. Again, I work with a great group of physicians and staff, and I probably have the best job out of the group.
Great. So, thank you guys all. So we just want you guys to ask questions about the care center, or any of the services, or things about illness such as limb-girdle muscular dystrophy that you want to know about in regards to the rest of the team that takes care of you and other patients like you. So questions that you have. Yes?
Are most of the MDA clinics organized along similar lines as what you just described?
That is the goal of the Muscular Dystrophy Association, is to have a multidisciplinary approach at all MDA care centers.
Okay.
Question.
Yes.
I was speaking with a gentleman earlier about this question. stretching.
Do it.
Okay. I didn't know, and the reason I even wanted to ask is because, as I'm sure a lot of folks know, that fatigue sets in and we don't want to overwork what we've got.
Yes.
There's a balance. So stretching, if we could just dig into that just a little bit on when it's good and how much.
I would definitely stretch every day. You want to maintain the range of motion in all of your muscle joints to help prevent pain. Exercise, you want to do low load, high rep more than high weight, right? It is about finding that balance. You don't want to over fatigue the muscles because, again, you still have to live your life, right? And do the things that you need to do. So if you're going and exercising so much, you're not able to do the things that you need to do. So you need to find that balance. But yes, stretching should be done every day on a daily basis.
My question goes along with that. How do you identify the line between enough to maintain and too much?
We recommend using logs. So kind of logging, use energy conservation, planning out your day, planning out your week, scheduling your activities, scheduling your exercise, looking at the priorities of the things that you have to do versus the things you want to do, and track your symptoms.
Is muscle soreness like the next, let's say, for people without disease, they exercise and the next day their muscles are sore? Is that a sign that it's too much exercise?
I think everybody's going to be different. So if you can still do the things that you need to do the next day with still having a little bit of soreness, that's okay. If you do your exercise and then you can't do anything the next day, that's too much. You need to back off from there.
And then I have another question. Is it possible to gain muscle, or does the disease prevent that?
I think you can build what you have. I don't know that you can regain anything that you've lost.
Okay. What do you mean by build what you have?
Like make the muscles that you have stronger, maintain the strength that you have in them.
Thank you.
Yeah.
How do you know for a child if something is too much or not enough, specifically a teenage boy?
That's a great question.
Yeah.
That's a great question.
How
I
do
think
say, no, that's too much, or
like setting limits. I think you're just gonna have to kind of set limits, kind of find that communication with what works, with figuring that out, right? So in clinic and stuff, in outpatient, we use the little pain scales with the faces, right? So even coming up with something like that you can track, saying, okay, how fatigued are you? Get different scales so it's more objective so that it's not so subjective on his side. So making it objective, that way you can measure it along.
Really familiarizing yourself, right, with the psyche of a teenage boy. So they don't want to adhere to any guidelines. They are not, and seriously, they're not going to want to say that they're limited, right? They're not going to want to be exposed. And we're speaking in general terms, right? I don't know your child. I don't know anyone's child here, but really just adhering to understanding that they are not going to want to expose kind of vulnerability and limitations, especially if they're dealing with some sort of emotional impacts, right, of having something that could be potentially limiting to them and being different from peers and things of that nature. So I mean, agreed, starting just basic communication, even finding someone who can help facilitate that. If it's a clinic day and I'm there, then I can help. These are kind of the conversations I can assist with, providing resources, connections to even community-based resources if needed, if communication really is at a deficit. So yeah, I can't answer, the medical component of it all, but definitely can address it, just being mindful of how every individual functions and meeting them where they are, if that helps.
yes, it does. Thank you.
In the back corner.
This is for, I guess, Jamie as well. You coordinate like benefits and stuff. So for instance, I was in the military, so I have VA benefits, just got VA benefits. So if I was there and working with the insurances in the VA, especially with DME, do you coordinate how that gets paid for? Do you deal with that? Is that part of what you do?
So I don't coordinate. I don't want to be misleading, right? I'm not able to coordinate. There's typically what I'll do is I can serve as an advocate. So if there's questions and you think that you're entitled to something and someone's saying, I don't think so, and somebody else saying, I do think so, I can kind of serve as an advocate for that. I do my best to understand kind of the ins and the outs of it all, but unfortunately, insurance and things of that nature, as we all know, is ever changing. And so there's different, even, again, there's different resources that are, their primary job is to know all the changes that are coming about. There are people, there's the Paralyzed Veterans of America. I'm not sure if you're familiar with that organization or if anyone is. They do a lot of assistance, or provide a lot of assistance rather, with educating, linking to resources, accessing benefits through the VA, ensuring that all of the benefits that you should be eligible for are there and available to you. So I work with them as well. So I just want to, just be clear. I'm happy to help in any capacity that I can, but sometimes it's out of my scope, right? Or out of my jurisdiction, and they say, stay in your lane, social worker. So what I do is I do my best to advocate and make sure that if there is any question or conflict about what you should be getting, then I'll do the research and I'll make the phone calls and I'll assert myself professionally to make sure that we get some clear understandings of things. Sure.
In the middle of the back.
In terms of equipment and assistive types of equipment, I was able to put up handicap bars for myself. I didn't see whether anyone could help me financially with that. I reached the point where I had to have hand controls put in my van in order to continue to drive safely. And apparently, there is no support for something like hand controls, which I think doesn't make a whole lot of sense to me, because that permits me to continue to do a lot of things. If I can't drive, there's a whole world of things that I can't do. And, it was scary because I couldn't get my foot from the accelerator to the brake fast enough. But with the hand controls, I'm great. And is there anything that can be done, or could the MDA Association, or who can lobby, or who needs to be lobbied, and how can we improve that kind of situation?
Well, that's a good question. I think that, when there's days on Capitol Hill, communicating with your local congressman, explaining that this is a need within your community, really, again, advocating for yourself, gathering the troops and having them do the same, and really identifying, so people often, it's unfortunate, but in the grand scheme of things, people don't really need or care or pay attention to things until it impacts them, right, or their family or their friends. So I think just making your voice heard in many ways. There are some grants in the community that are very small. There's always an application process, eligibility requirements. More oftentimes, there's resources available for medication as opposed to something like hand controls, which it's very frustrating being a social worker oftentimes, because I understand what quality of life is. I understand that everybody has an individual concept of that. I understand that driving can be very impactful on one's ability to be independent, maintain that independence, have a quality of life, be social, all of those things. Unfortunately, the resources in our nation just aren't there to address certain concerns. And so I think that just again, asking these questions, making yourself aware, going to whatever platforms you can be heard on, gathering your folks to do the same. But I'm always willing to investigate to see if there are any grants out there. Sometimes we don't know, and we stumble across things when researching something for another patient, and I'll keep it in the back of my mind. But yeah, that's a good question. Unfortunately, we all, even providers, are forced to work within the limitations of the same system, right? So, I always say I wish I had a magic wand. I wish I was a miracle worker. Unfortunately, I'm a social worker, and there's insurance, there's caps, there's all of these things that all of us are impacted by, including yourselves. But yeah, again, just being the best advocate you can for yourself, and kind of rallying everybody to do the same, and talking to your social worker to see if there are any grants or any resources for the particulars that you all need.
In the front.
Yes, sir.
If we come to your clinic, is that once a month, or how does that work?
We have clinic every Tuesday morning.
Oh, you do?
It's always on a Tuesday morning at our Short Pump location.
Okay.
And we can have information with a telephone number if you wanted to reach out and call.
Okay.
But every Tuesday morning we have a neuromuscular clinic.
Regarding his last question, I have found a wonderful benefit is Craigslist. You can get wheelchairs, walkers. I had to have a lift from my house. They're $30,000 if you buy one new. You can Sometimes if you watch out, get one for $3,000. I mean, I think the state provides tax credits for modifications to your house. I think it's a limit how much they provide every year, but that's out there too. It's a credit on state income tax only.
Right, and there are, like, if you're a disabled veteran, there are in certain localities, you have tax breaks or elimination of, like, property tax, things of that nature. Yeah, definitely, DME, you know, any kind of equipment needs, Craigslist, of course, you know, the mom and me and the social worker's like, safety first. There's special spots that people can meet up. Even there's some police stations that will say, you know, there's cameras and things that you can meet up to exchange those items. You know, we just want to make sure that you're mindful. So if you acquire a piece of equipment from someone, a family, a friend, Craigslist, you purchase it, just be mindful that insurance will not modify, they won't touch that piece of equipment. So, you know, if there's, you know, we've had inquiries about, oh, can I get this adjustment to my power chair? Well, but it was my cousin's. Unfortunately, your insurance is not going to cover that. The actual piece of equipment needs to come. Again, loopholes and things that we need to figure out. But you're absolutely right. I mean, there's the Free Foundation, there's the loan closets through the Muscular Dystrophy Association that you can acquire equipment, and it's just all, you know,
Is that
need-based.
here in Richmond?
Yes, sir.
Oh, okay.
And that's something that they facilitate at no cost to you. Again, it's first come, first serve. It's a matter of availability. You know, if they don't have a set number of walkers per se or rollators and things of that nature, but if it's there and there's a need, then we can help. I mean, Nikki Benefield and I, we work very closely together. We all do. You know, let's just we work collaboratively together. We all care very much. But Nikki and I in particular, if I know that there's a need, or any one of us will come out of a room and can, you know, let Nikki know that there's a need for a DME.
Used Wheelchairs USA in Smith Mountain Lake in Virginia is a good source for used equipment, used wheelchairs, power chairs, and so on.
That's good to know.
And what new would cost you like $20,000, you can get for 4 or 5.
Okay. Well, thank you for sharing.
But you're right, then you're on your own in terms of repairs and stuff.
Facebook also, Facebook
Marketplace.
is a good source as well.
That's right.
Over here.
I just had a question regarding the whole law and legal ramifications. Does the MDA have a legislative engagement team that would champion issues like that?
I believe that they do.
Yes, we do. We have MDA advocacy, which is a whole part of our organization that's geared towards that specifically. And we actually have a lot of information on that. If you're interested in it, I can definitely talk to you and we can get that for you.
I was just kind of thinking
Yeah,
that instead of, you know, trying to do it
On your own.
on your own.
Oh, yeah, for
there
sure.
was something already set up.
Yes, ma'am.
We have something similar to a whole body like vibration platform at home, and I was just wondering if it's safe for someone with muscular dystrophy to use that, or if it's beneficial.
We would kick it to the doc and ask that
Yeah.
from therapy standpoint.
I don't know if there's any evidence that would support it or to say that it's harmful.
Could you repeat the question, please?
She mentioned that there was a whole body,
It's like a full body vibration
Vibration.
platform.
so a whole body vibration platform, and is it safe in patients with muscular dystrophy? Or specifically limb girdle? I don't know. We would have to look at it. We'd have to do research behind the safety of it, right? Because the most important thing first is do no harm. And so we would have to look into it and see exactly what the specifics are. So that would be something when you go to a care center to talk with the physical therapist, occupational therapist, and the physician. So bringing that information with you so that could be discussed would be really important, because it may be, but we just want to make sure it's nothing that's going to cause any harm. So bringing that information with you to discuss with the care team, where the whole team can look at that information, would be a good idea.
Thank you.
Other questions people have? Over here, gentlemen.
All right, my question was asked before, but apparently I have a limb girdle, but I didn't even know there's different kind. How do I go about finding out? Apparently they took my blood samples twice. Second time I never heard about that. And I'm from Myrtle Beach, South Carolina. Neurologist I went to see, he didn't know nothing. They sent me to MUSC, and that's where they found out, you know, that I have a limb girdle. But that's, you know, about hundreds of miles away. So that's why I came to see you nice people. So where am I supposed to do? Where am I supposed to go?
Well, one of the, as they mentioned in Dr. Johnson's talk earlier today, the readily availability of genetic testing is there now. And so having a first test that was done, alluding to what Chelsea said, that may have been a year or two ago and where there was no certain diagnosis, doesn't mean that 1 to 2 years later it shouldn't be tested again. So as we're learning more and more about science, we're learning more and more about different types of limb-girdle muscular dystrophy. And so don't give up and continue to follow with an MDA care center. It may need to be repeat genetic testing.
But where? I mean, you know, I like you guys, but a little bit too far.
Come on, you would like that.
So
That's it.
we can
They
get,
said if you promise to help me, I'm coming. Once a week.
well, we need to make sure you touch base with the MDA team because they'll let you know all the care centers that are closest to you so that we can ensure that you get the care that you need. As mentioned in one of the earlier, just right before us, with Nikki and Sarah, is that a patient who has an MDA disease can be seen at any care center, and they have the ability to get access to that. So we need to make sure as soon as the session's done that we get all of your information to help you with that.
Okay, and on a good note, I got a share lift, wheel share lift, that MD donated, give it to me. I had to put about, $800 in it or something. And I don't need one because I got one over here. So I'm trying to give it away to somebody. And I call MD, they used to be in Wilmington, but now they moved to Raleigh or something. And he says, well, I'll let you know, see we have a room for it. So I'll be glad to give it to somebody. All you have to do is drive 300 miles to pick it up. But I'm serious, if you have somebody.
Thank you.
Yeah, I can always, I mean,
And there's
I have,
nothing wrong with it, I had it all fixed, I just never used it because, I got a little scooter and she just takes it apart and throws it in and she says, I don't need no lift.
well, I can always give you my business card if you like
That's it.
after, and then we can communicate, and, again, if there's
Well,
somebody
it's
more
a
local to you, but even if we
It's a
find a
shame to
need.
throw it, because that's where it's gonna go, it's in my garage and it's gonna go by the road.
Right.
Nobody- that's it.
Well, thank you for that.
Thank you.
Question over here.
I think it's for you. I understood from the presentations in the morning that you don't have a lot of ideas of what to expect with the limb-girdle. My son is 18 and he has 2A, and his doctor is sure he's not gonna walk in 1 or 2 years. Is that true? I don't know. Do you know or you don't know?
So, the question was about her specific family member and when or when not a patient would stop walking. Every patient, there's even variability between patients, and so we can't say specifically at a certain time or age when a patient would be. Your doctor, who is following you, probably has a pretty good sense in regards to disease progression for that specific individual. And so, there are things, as the therapist talked about, ways to try to continue to keep people active and healthy. But if your doctor, who has followed your family member for a period of time, feels that it's probably pretty close to accurate if that's what they feel. But it's hard for us to say without having seen the individual, because there is variability even between disease. I think that was brought up in every talk today, is that there is variability between the limb girdles, but even in family members who have the same disease, we do see some variability in regards to disease progression.
So if I go to a webpage to look for that specific limb-girdle, I'm not gonna find something very I don't know. It's just that I'm very new with all of these. We're very new, and we don't know what is gonna happen. You know what I mean?
Well, I think one thing it would be perfect too is the getting into natural history studies, because that is why these natural history studies are now being developed. Is as there's so many more different types of limb girdle, we're still trying to understand all the variability within them, and that is one of the things that Dr. Johnson has been very successful about, is developing these natural history studies so that we can get a better sense in an individual, but in an entire subset of a disease population, is how they do progress. So it would be really important for someone to consider being part of the natural history studies.
How do you get to be a part of that?
So I know that some of the information was mentioned earlier. There is a table out here that has contact information for you. So I would, and then this is also being video recorded. So we will make sure you get all the information. But there is information right outside here to the right. So at our next break, which is in 15 minutes, we can make sure you get that.
Or we can give, we'd like to give Brittany Holmberg's email address and people can contact her to the right place.
All right. So we will make sure you get that contact information before the end of the day.
So if you can input your data into this natural history grouping, are we are doing the inputting gonna be allowed before it is completed to determine that, hey, there's 30 other people with the same 1E that I have, and they all started in the 50s, and by the time they got to 60, they're doing this. So in other words, we're gonna be able to see an uncompleted analysis.
So that would depend on how the research design is set up. And I would defer to Dr. Johnson and going through the IRB protocol of how information is reported back, because I don't have those specifics, and I don't know if that is specifically known, but there is certain protocols.
I mean, I think it's, anytime you participate, same as if you come to clinic, you know, your participation is confidential, so we can't unfortunately share back who else in the study has your mutation, but.
Well, not necessarily the individual by name, but the symptoms themselves and how it's presented.
Yeah, we're always.
Yeah, and all that information, ultimately, the goal of those studies too is to publish that information so that it can be shared with the community at large. So ultimately, that information is shared.
Looks like this young lady up there is trying to determine maybe when something will happen, a benchmark.
Yeah.
Well, if you're part of a study or part of this input data, it'd be nice to know in 5 years, I'm gonna kick the bucket. Yeah. By half.
And that is exactly why Dr. Johnson is leading this big consortium, because this is the information that you guys want to know, and this is the information that the scientific community needs to know if they're going to design the right clinical trials. So yes.
I think along the same lines, is there a way that we could have like a social site or a Facebook page or something where it was an LGMD group that we could ask each other questions and share information, because you find out so much. You're talking about other people that have gone through it, but if you've got to sort through every person in the world that's ever used a wheelchair, it's harder. And it would be nice to, since it's something that's rare and you don't run into people with the same thing very often, it would be nice to have a group where you could talk about that.
So I'm gonna let one of our attendees today talk a little bit about that.
There are actually a couple of groups on Facebook, and just to let you.
Let's have them give you a microphone so that everybody can hear you.
Take it up to them. Oh, she has one right there.
So there are actually several Facebook groups that are already established. Some are general, some are specific to your type. There is a website, lgmd-info.org. If you go to there and go to their resources page, you can find all the different Facebook pages that are available that would probably help you out. So that's a great page because it's just a catch-all, and it also has a list of the patient registries if you've got an individual type that has taken registries. So yeah, there's also other Facebook groups available if you've got questions about disability, which hasn't been brought up yet, which so if you're working and worried about disability and how to apply for it, there's a platform for that too. So there are groups for just about everything.
So that would be perfect during the social hour afterwards.
Yeah.
Nina's gonna be the center of attention.
She loves it.
But the social networking is really important in regards to not only living with the disease, but helping to advance our understanding of the disease. Other questions? Yes?
Jay Lee, you mentioned, for short-term care, we're having a bad day, we talk to you. Is there a special psychiatrist, psychologist for long-term care, for patients and or caregivers? Is there one that you could recommend?
There's a few that in particular that I know in like the Central Virginia area that can help with adjustment to illness. Also, there's some who more specialize in anticipatory grief, but even though that's their kind of their specialty, they understand also disease process, right? So even if grief is not necessarily an issue or anticipatory grief, understanding a process and following in that journey. Really what I like what I usually do is I sit with the person and I say, what is the criteria that you're looking for? Because from a counseling perspective, it's not going to work unless you really click with that person. And so I get down to specifics, what kind of even ethnicity, gender, age range, specialty. Some people want to go 50 miles out so that they're not, found out about that they're going to counseling because they might be crazy when it's really not at all. But so just really working with the person and figuring out what's going to work for you. Oftentimes on the back of your insurance cards, I know a lot of people have been offended by the behavioral health phone line instead of just member services. But so behavioral health means, it doesn't mean that you have any behavior disorders. It just, that's what they're classifying it as. So if you need to find a counselor who's in network and you kind of want to skip going, and searching in your locality and want to get a list, oftentimes insurances can generate a list based on different criteria that you want in a counselor, and then you can already avoid knowing that they're in your network and will provide or receive your insurance and take your coverage. So ThriveWorks is one particular agency, but as somebody who works for the hospital, I try not to promote any particular vendors or agencies, right? Because there's so many different ones out there, and it really just depends on your individual needs, your insurance coverage, things of that nature. Oftentimes people are worried about going to a counselor again because they don't want it kind of a paper trail, if you will. There are options for private pay, even for counselors. I'm not going to sit here and say that is inexpensive by any means, but again, these are some of the options that are out there. And so, I do try to kind of do that brief intervention, really just seeing if somebody needs some guidance in that moment. I think we all believe that the psyche or your mental health can impact your physical health to a certain extent, right? The brief answer is that there are a couple out there in the Central Virginia area. One of them works for ThriveWorks, which is a counseling group that have quite a few locations throughout Central Virginia and Richmond area. But it's really just about figuring out what's going to work for you.
Is there a special field for this?
No, so any counselor really, whether they're a licensed professional counselor, an LPC, a licensed clinical social worker, an LCSW, or a psychologist, a PhD, psychiatrists again, just are usually for medication management, and they'll work in conjunction with talk therapists, if you will. But really, any credential in a counselor is going to work. I always tell people, read their bios, look at their pictures. If you don't think that you're going to be able to see their face for 50 minutes straight, don't go to them. But some specialties, dealing with anxiety and depression, right? That's a very natural response. I often question when people are not having some symptoms of anxiety or depression when receiving a diagnosis or adjusting to progression of a disease. So looking for people with those kind of subspecialties, anxiety, depression, who can understand kind of, again, that nervousness, that anticipation of what's to come, what does this disease process mean. Also, like I said, sometimes people who have worked with have specialties for anticipatory grief. That's also anxiety based, and so those are some of the keywords you might want to look for. But they're really, I have yet to discover somebody who is as specific as working, with this particular patient population. But those are some of the specialties or keywords you'd want to search for.
Thanks.
Sure.
Other questions? Yes.
I know you said that the goal for MDA is to have this type of support network in all the MDA care centers. For folks that are not from the Virginia area, if our MDA treatment center doesn't have this sort of stratification or folks with these credentials, where do you recommend that we go to for resources?
So I would say reach out to your local MDA representative, and they can help. They can help to coordinate your care at any care center. So they can help to coordinate that.
So if they don't have somebody under their employ, they can recommend somebody in the community.
Yes, in the back.
I think that's something that MDA might be able to help us with, like, overall too, because I know it's important to have the different things like the respiratory therapist and OT, PT, along with your neurologist, but there are other doctors that are hard to go to when you have to deal with the extra stuff like that. Like if you need to go to a dentist and you can't fit in the office there, or be nice if there was a network that way, or if MDA could help us to either train doctors or find doctors in our area. Because I've asked my local doctor, and he said it just doesn't work that way, and they don't know. But it's hard to find somebody that can see you, and it can be so hard to get an appointment that when you've got to wait for an appointment, and then you get there and you can't get in, or they don't have any idea what you're talking about, that makes it hard.
Well, I think those are great comments, and that's actually why the MDA is setting up these across the country, because they want to hear the voices of the patients. They're calling it engaged because they want the patients to be engaged in their disease. So you have lots of MDA representatives here who are listening to you, so that's great.
And on a side note, as part of OT before, in one of my sessions, I've worked with patients calling different offices for the dentist, seeing if they are accessible for wheelchairs, and kind of facilitating that conversation. And training the patients how to ask these questions when you are calling.
I have a question. I'm with Sarepta, and this actually came out of a conversation I had with a family earlier, and I found it really interesting. Are there differences in how patients respond to limb-girdle or experience limb-girdle by their like pain threshold? So like women through childbirth can perhaps experience more pain than men, and there are like some other factors. Just if you're a person who can endure more pain, perhaps you speak up more, you can do physical therapy differently. Like, could you just shed some light on that? And perhaps the answer is just a simple no, but I was just curious if there are any thoughts around that.
Yeah, so I guess I'll chime in. I think the answer is we don't know. And because there is so much variability within the diseases, and then not only then about diseases, but just in regards to individuals and their pain tolerance, and so we don't have good natural history and to have that. So I think the right answer is we don't know.
Yeah.
And I think we have to individualize all the treatment care plans because we just don't know. And then I know there's another
I
one.
want to make a comment. The lady talked about going to places that can't accommodate, like the dentist chair or anything else. I wish everybody here, when they go to a hotel or motel or anywhere that really doesn't meet ADA, that they really speak up, because we've got to be the advocates for that. And if we don't do it, then nothing is going to change. And I've been to hotels that swore they just had their bathrooms redone, and they met ADA requirements, and they were just terrible. So please, everybody, raise heck.
We even went to one where we supposedly got a handicap, ADA accessible room, and the door to the bathroom was so narrow, he couldn't get in it. So there really is not any standardization.
And when, I guess also, when you find resources or certain places, hotels or certain dentists, maybe sharing that in your Facebook group or letting your social worker in that clinic know, whatever clinic you attend, because what I've done is I've compiled lists and resources so that they're readily available. So if you say, hey, do you have any recommendations for dentists who can accommodate somebody in a power chair? Say, well, actually, instead of reinventing the wheel, I start to collect this information and then create a list, right, so that I can hand that out. So I can't help people in South Carolina with the list. My list is local, but again, just speaking with the people in your area and giving that.
But I tell you what, you can have somebody over here.
Yes.
I call over, nice place over here, nothing against it. I call handicap room. Beautiful room we got upstairs. Guess what? Commode is one of those that I changed him 5 years ago. You know, it's the low one. That's not handicap.
Yeah, it's about that tall.
That's it. I mean,
Not to mention the toilet seat's not bolted on tight.
and that's for handicap.
Yeah, right.
The shower head is way too high.
I do think that is where the social networks that have been developed so that you guys can find out from each other.
So you see, that's in Virginia, so you.
I'm on it. I'm on it.
Go ahead.
I just wanted to address the pain aspect of it from the groups that I've been in. There are different kinds of pain. So you've got the overworked muscle pain. Then you have the joint pain because you have no muscles, right? So it depends. There's a whole range of where the pain could be. And it could be that you're favoring one side because you've lost the muscle on the other side. Now, when Dr. Wong Sean was here, he actually recommended a Quell device, which you just strap it around your calf muscle. It's like a TENS unit, but it operates, it runs up and down your body. And I didn't get one, I got one for my husband. It works great for him. But in the group, several people have tried, it's quellrelief.com, and they have a 60-day warranty or guarantee, they need to return it. But there are non-pharmaceutical options that I think everybody agrees that you'd want to try first. And so, I'm sure that Ashley, and everybody there has an idea of different techniques depending on what kind of pain so you kind of have to identify what kind of pain are you having. Some people, it is possible to have fibromyalgia on top of limb-girdle, and so you think you're hurting all the time, it may not be the limb-girdle. So don't give up with your doctor before you identify what's going on. So that's my preach. I'm done.
All right, leave a chance for one or two or three more questions. Any?
I have a question, I think it's for the doctor behind me. He had mentioned earlier progress in drug development and LGMD, or limb-girdle, in the last 5 years. What drug is that, and is that for the human, or is that just in the mice?
So I'm going to hold on your question for the next session because that is on drug development.
Okay,
And so that is going to be specifically talking about how that process works. And with every step forward, it continues to get closer. Any last questions? Yes.
So for the lady, for the guy that you were talking about, the natural history, study, just to kind of give you an idea. So I was diagnosed with limb-girdle at 12, and when I was 12, they didn't have all the subtypes yet, and I didn't get diagnosed with this correct subtype until 2007. And I was 12 in '94. So when I first got it, my disease progression was incredibly fast. I would wake up not being able to do something I could do a month ago. And then when I hit 16, 17 probably, it kind of leveled out. None of the doctors knew what was going on at the time. They were like, oh, yeah, and they told me, you're not going to be able to walk in this many times. I can still walk, not long distances, but I can. But it leveled off, right about 16, 17. My younger sister, she didn't start presenting symptoms until she was probably 18, 19, and her progression has been so much slower. She's 31 now. She's 34 now, and she can still do way more than I could. I mean, she's like I was in high school. And then my youngest sister was a friggin' cheerleader for college, so she has nothing. So, it's so different. So just because it's fast right now, obviously listen to your doctors and stuff, but don't, it's not the end all. It's not going to necessarily keep going at that pace. I mean, everybody's different, but that was just my thing. And then my sister is so different from that, and then my youngest sister is completely different from that. So just even in the same family, like they were saying, it really varies, and just patient to patient, year to year, day to day, month to month, it varies. So.
Great. One last question.
Can I just add something in?
Yes.
I'm the neurotic one of the bunch, so I put together a handout that'll go over how you can be proactive in keeping you as healthy as possible, what your numbers mean when I do them in clinic, what some concerns are from your limb-girdle if you aren't proactive about keeping your lungs healthy. So I'll pass that out after this session's done.
And just to piggyback off that quickly, ultimately we want to make sure that you're being honest with yourself and you're being honest with us when you come in to see us, because the best way that we can assist you always is knowing what's really going on. I know that's not always easy. It's always easier to put on a facade, right? I'm fine. We say that all the time on a daily basis. I'm fine. I'm okay. I see some chuckles over there. So, just again, just making sure that you're being honest with yourself, you're being honest with us, and you're going to find different people on your team that you can be more transparent with than others. Make sure you're identifying those people and that you're getting to see them when you do have your appointments. Advocate for yourself. Feel empowered that it's your time while you're there, and that you need to always have a takeaway, if not 1 or 2 or 3, when you leave your appointments. And if there's any way that any of us can help you, or even trying to figure things out in the interim, please let us know, and we'll do the best that we can.
Great. And thank you for being here to answer all the questions. And thank you guys for asking all the questions. That was wonderful. Now, we do have our last break, so everyone, there are snacks across the hall, and then we're going to come back and have our last session about drug development. So we'll all meet back here in 30 minutes? 30-minute break. Okay.